Your child has been evaluated in the pediatric emergency department for their injury and placed in a splint. Now let's take a moment to review the importance of splints, how to properly care for them at home, and some warning signs that you should look out for at home that would indicate you should return to the pediatric emergency department. Splints are used to help support and protect many bone and soft tissue injuries. They keep an injured area from moving and help promote healing and prevent further injury. Splints don't fully enclose an injured area, making them ideal for use for many acute or sudden injuries where swelling is likely to occur. This is different than casts, which are harder and fully enclose an injured area. Though your child was placed in a splint today, when you follow up with your orthopedic surgeon and the swelling has improved, your child's injury may still require a cast. Now that your child is about to be discharged home, let's take a moment to review some helpful tips in caring for their splint. It is important to keep your child's splint dry at all times. When bathing or showering, they should keep their splint out of water. They can protect the splint with a large plastic bag taped or rubber banded at the end closest to their body. If the splint does get wet, make sure to dry it with a hair dryer on the coolest setting. It is important to monitor the skin around your child's splint daily. Look out for redness or rawness to the skin. If your child develops any of these symptoms, make sure to contact your healthcare provider immediately or return to the pediatric emergency department for reevaluation. As with any injury, swelling may occur. In order to help with swelling, elevate the injured extremity regularly. Make sure to apply ice as needed to help with pain and swelling. The ice can be placed in a plastic bag or use a cold pack to avoid getting the splint wet. In addition, ibuprofen and Tylenol can be given as needed for pain. It is essential that your child follows up with their pediatrician or orthopedic specialist for reevaluation of their injury. Your emergency department provider will have given you specific details on how soon you should arrange follow-up with an orthopedic surgeon or your pediatrician. Make sure to follow these instructions. When you return home, continue to monitor your child's cast regularly. If they develop any tightness or pressure under the splint, have numbness, discoloration, tingling, coldness, or are unable to move the fingers or toes in which their splint is applied, the splint cracks or stays wet for more than 24 hours, or if you notice that the skin around the splint becomes red, irritated, raw, or painful, return to the pediatric emergency department immediately for reevaluation.